Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by CAMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Vance Lassie of Holton about ear infections. Thanks for being here today.
Thanks for having me.
Now, with ear infections, what are they and how do you get them?
Ear infections are pretty self-explanatory. It's an infection inside the ear. There's different chambers of the ear deep inside your skull, and whenever those inner and middle chambers get full of fluid and infection and bacteria and viruses, that we would call an ear infection.
Okay, are they preventable?
I guess I would say yes, just in the same way a cold is preventable, but you tend to kind of get them sometimes anyway, particularly children. However, I would say one thing that certainly is preventable with kids is the exposure to cigarette smoke. Cigarette smoke exposure definitely will increase a child's risk of getting ear infections, particularly recurrent ear infections.
And how do you treat them?
Depending on what the cause of the ear infection is, there's different treatments. It's important that if you get an ear infection or if your child were to get an ear infection, that you would bring the child to the doctor or go to see the doctor, because that needs to be examined. Sort of traditionally, I think antibiotics have been given for just about all ear infections. But the fact is, many of those don't need antibiotics, and because of the use of such prolific use of antibiotics over the years, we now have a lot of bacteria that we can't kill. They've developed a resistance. And so we do try to recommend the use of antibiotics for ear infections only when necessary. But we have some other things we can do, drops that help numb the ear so it doesn't hurt so bad, so on.
Okay, and how do you know when to call the doctor?
If you have a little one, usually the screaming and tugging on the ear kind of prompts you to take the child to the doctor. For an adult, there's usually just pressure and pain often in the ear. And in certain cases, even like a rupture of the eardrum, you'll have drainage out of the ear. And you should go see your doctor when that happens, for sure.
Okay. All right, good information. Thanks for being here.
Sure, thanks a lot.
Please join us next week for a new health topic discussion on House Calls.